Welcome to Wet Luminous. Today we are performing a surgery called as Cryptorchid. Cryptorchid is a condition which occurs to male dogs in which one of the testicle failed to descend into the scrotal sac. Before going for surgery, I just want to give a brief information regarding the Cryptorchid. What is Cryptorchid? How it all happens. Okay. Coming for a small presentation, Cryptorchid in a dog. So basically, before going for the actual surgery, I want you to understand what is the importance of this surgery, why it happens, what is the fate of the testicle. As I mentioned before, cryptorchid is a condition where which one of the testicle or both the testicle fail to descend in the scrotal sac. If it is only one testicle, then we call it as monarchid. If it is both the testicle, then it is called as testicular cryptorchid. So coming for the anatomy of the scrotum, so we have this something called as a testis. Testis is been having epididymis. Epididymis is having various structure. The major structure which we all have been concerned here is this pampliform plexus. Pampliform plexus is a plexus which regulates the thermoregulatory system of the testicle. So normally testis lays outside the body, so the temperature of the testis is 2 degree less than the normal body temperature. This is very necessary for all the sperms and the testis to function properly. Whenever this testicle fails to descend in the scrotal sac, the other testicle stays inside the abdomen or any other structure. Because of the change in the temperature, the other testicle may not be functional, or it may become hyperfunctional and may lead to testicular tumors or testicular atrophy. So this is the importance of pampliform plexus in this anatomy of the scrotum. So coming for cryptorchid, what happens during the early embryogenesis? The testicles lay very close to kidneys and they stay intra-abdominal. During the time of birth, the testicle will descend back into the scrotum. If the testicle fail to descend back into the scrotum, then these testicles are called as cryptorchid. So where are the usual positions of this cryptorchid testicle? There are three things. First, they can be in the scrotum, which is a normal behavior. Second, they can lay near to the inguinal canal, or in the inguinal canal they may lay. Third, they stay inside the abdomen. So the dog which we are going to perform the surgery, in this dog we have this particular testicle located in near to the inguinal area. So we will be performing the surgery. As the surgery goes on, I will be telling you the further information regarding this condition. Cryptorchid is a usual abnormal condition which happens because of failure to descend the testicle into the scrotal sac. Thank you. Okay. Yes. As we all know, this is the patient having a cryptorchid. You can notice only one testicle present in the scrotum. So normally in case of cryptorchid, either the other retained testicle or the undescended testicle stay very close to the inguinal region or inside the abdomen. So in this patient we can able to palpate one of a mass like the structure here, suspected to be undescended testicles, which is present over here. So initially we will be starting doing a routine castration surgery for this own testicle. Then we'll try to dissect over here and try to explore this particular area to identify the other undescended testicles. So as the routine procedure goes on, in front of the scrotum, so just I will be pushing the testicles in the front and I'll put a linear incision on the testicles. I'm just trying to dissect the subcutaneous muscle, and with a gentle pressure I'm going to pop this testicle outside. Now one of the testicle is outside, which is the descendant testicle. I'll be doing the castration surgery for this particular testicle. So this is also called as orchidectomy, the surgical procedure performing castration. The surgical name is called as orchidectomy. As you can notice here, there is one of the bundle, a vascular bundle and a vascular bundle. I'll be removing the vascular bundle from the attachment to the testicles. Now we can see the bundle is separated. Now I'll be putting my hemostat, one hemostat distally, one more hemostat proximally to it, and I'll be placing a suture just below this. So now I'll be ligating all the bundle together. So I'll first try to ligate the whole bundle, then I will transfix it. Similarly, a surgeon note for the ligation. Then I will transfix this particular bundle which has the artery, vein, muscle and the vas deferens. So I'll clamp this particular structure. So as you can notice here, now between the first and second clamp, I am going to remove this particular bundle. This is how a routine castration is done. Any bleeding or anything as such. So as there is no bleeding, you can remove this. Okay. Routinely people say that there is no need to suture this bundle, avascular bundle or avascular sac like this. But usually I put a small ligature for this also, just to be on the more safer side. So I'll be closing this particular tissue, the underlying subcutaneous tissue. So to finish the castration surgery for the descendant testicle. Okay. So here I am using 20 suture material. This is a dog weighing 5 kilo. I am using a 20 suture material to close the subcutaneous tissue, and meanwhile I am closing top layer of skin in a mattress suturing pattern using a non-absorbable silk size 20.
വീഡിയോ വലുതായ വ്യൂവേഴ്സ് ഉണ്ടാവുക, ചെറിയ വീഡിയോസ് പിന്നെ പിന്നെ വേണ്ട.
So now our next plan is to identify or explore this particular region where you can see a swelling and you can palpate a small round structure like this. So here I'll be putting a linear incision. I'm going to put a linear incision on that. So here we may have to go very deep inside. We may have to do a lot of dissection because here a lot of fat and muscles are present. So we can notice something here with a gentle pressure. Yeah, this is the one more testicle you can notice here. So now we'll just try to dissect it out. You can see the structure over here, a small round structure having a bundle of vascular bundle and avascular bundle. You can notice very clearly here. So I hope it's very easily visible for you. Okay, we shall try to dissect it out. Here, clamping, two clamps. First clamp, second clamp. Now I'll put a suture or a ligation. So I'll just try to pass the ligature below the first clamp. Okay. I'm just going to check whether the ligature is proper or not. Yes, it's proper. So now the gentle pressure, I'm going to tighten it. Also, that it will give a more security and the risk of bleeding is very less. Okay, one more knot. Yes, it's more secure now. One of the clamp to hold the sutures, then remove the excess suture, then between the first and second hemostat just try to resect it out. So the one more undescended testicle has also been removed. Okay, the position now, as you can notice, this is the one more surgical site here. I'll be closing it with a routine closure by using all the subcutaneous tissue. I'll just close it. This is the final outcome of the surgery. So this is a normal surgery for the descendant testicle. This is a surgery for the undescended testicle. In this patient, the testis was near the inguinal region, so we were able to take it out easily. In case of some other cat dogs where the other testicle, undescended testicle, is still there in the abdomen, then we have to open the abdomen and try to explore the whole abdomen cavity to identify the testicle. So normally in case of testicle present inside the abdomen, the testis will be very close or very towards the besides the bladder. That's what the location is. Anyway, the surgery is done now. I just want to show you the two testicles. So this is the normal testicle, the descendant testicle. As you can notice, this is the other testicle which is smaller in size when compared to the earlier one. This is why, because in case of testicles, the body temperature and the scrotal temperature, it is almost 2 degree less. Means the scrotal temperature is 2 degree less than the body temperature. As the body temperature is high, in this condition, this particular testis goes up to into a condition called as atrophy or smaller sized testicle. We can notice over here. This is the last testicle, small testicle, descendant, undescendant.